Is it lights out for your thyroid? In our little discussion here, we're going to talk about how thyroid problems are not always due to the thyroid itself. And this presentation will give you some basic understandings on how the thyroid functions and how the thyroid actually should be working in concert, integrated with the rest of your body. What is health? Dorland's Medical Dictionary states that health is optimum mental, physical, and social well-being, and not merely the absence of disease or infirmities. In our current healthcare system, we focus so many things upon the symptoms. What you need to realize about symptoms is that they are only a warning indicator. It's very similar to the dashboard of your car, and you may have a red light that comes up that says check engine. Well, that doesn't actually tell you where the problem is. It just simply says that something is not working right. And this is how symptoms work in our body. They're not always specific for where the problem really is. They're not specific for how long the problem has been going on. And they're really not even a good idea or they're not really not even a good way of measuring how serious a problem is. You could have some symptom that, let's say you've got something in your eye that's driving you crazy and it's causing you to blink and it's just really frustrating you. But that is not a big deal compared to plaque that may be forming inside your coronary or heart arteries. So symptoms are not a very good way of helping to evaluate your status of health. And when we have a system that focuses primarily on identifying what your symptoms are and then taking treatments, medications, drugs, vitamins, whatever it is to eradicate those symptoms, we're not working on the source of the problem. So simply having symptoms, not a good indicator, but even the absence of symptoms, if we don't feel like we have a problem, that's not always an indication that our health is good either. Some of the #1 killers in the U.S. are things that start silently and affect us in a very profound way. So the purpose of our little mini presentation here is to help you understand where some of these breakdowns may be. So to start this, I want you to look up at the light in your house, and we see that light bulb in the ceiling. And if that light bulb were to go out, we may need to replace the light bulb. That may be the problem. But the reality is that there is actually a chain of things that could happen or are linked to that light bulb staying on or going off. So for example, if someone flipped the switch off at the wall, the light would go off. Now we can go change that light bulb, but it's not going to make that light bulb go back on. Well, let's say the light bulb is good, and let's say the switch is good, but let's say that there is something that is wrong with the circuit panel. Let's say the breaker tripped, there was a storm or a surge. Okay, now it doesn't matter how many times we flip that switch or how many light bulbs that we change, that light is not going to go on. Let's take our analogy a little bit further. Let's say something happened to the transformer outside and it blew. That could be a problem causing the lights to go out. Let's go even a little bit further. Let's say that the power plant had a breakdown or a malfunction. So as you can see in this analogy with lights and your light bulb going out, the light actually is the symptom. It's not working. But having the light go out doesn't necessarily tell us if the problem is with the light switch or the circuit panel or the transformer or even the power plant. Now let's take this analogy and carry it over to thyroid function. I don't want to get really super technical, but I want you to realize some players here in the thyroid and its functioning. In the brain there are two major areas. One is called the hypothalamus and the other is called the pituitary, that act as relays and deal with hormones, and we'll get a little more into that. Then we have the thyroid itself, which is going to be this one right here. And then the thyroid produces hormones, and those hormones need to be acted upon by different parts of the body. This would be your liver here. The digestive system would be another area. So let me move on to that slide here. So let's get into some more details. So your hypothalamus, which is an area inside of your brain, it produces a hormone called thyroid-releasing hormone. Now that hormone travels to the pituitary gland, which is another area of the brain, and it tells the pituitary gland to produce another hormone called TSH, thyroid stimulating hormone. Now the thyroid or the pituitary gland produces other hormones too. We've got growth hormone, ACTH, LH. We're not going to talk about these right now. These are a different pathway. Pituitary produces thyroid stimulating hormone. Now TSH it does exactly what it says it does. It stimulates the thyroid. So if your thyroid is working too low, TSH is kind of like a kick in the pants to get the thyroid gland to begin to produce more of its hormones. And the way that it does that is it causes an enzyme called TPO, stands for thyroid peroxidase, to stimulate the release of T4 and T3. Now T4 is considered the inactive form of your thyroid hormones. So if you notice, most of the hormones that are produced by the thyroid are actually in an inactive state. A very small amount is in the T3 form or the active form that can be utilized by the body. And what happens from here is that these hormones bind with a protein called thyroid binding globulin, TBG, and as I put here, it's like a taxi cab. So if you can picture in your mind, these hormones will hop into the taxi cab, bind with the TBG, and then the taxi cab will drive them through the body to areas where now these hormones, specifically T4, can become acted upon by other parts of the body to become active. So T4 can be turned into the active T3, not in the thyroid, mind you, but in other areas of the body. Now 60% of your T4 is converted to the active form of T3 in your liver. 20% is converted in the gut, and 20% in other tissues. Now remember the analogy that we talked about with the lights and different areas in that pathway from the actual power plant to your light bulb could break down and cause problems. So if we have a problem with your liver, let's say your liver is not adequately meeting the demands placed upon the body, this can potentially reflect back to to thyroid gland function. Okay, look at that, 60% is converted or activated in your liver, 20% in your gut. What happens if you've got poor gut function, which most of us do? And a lot of it is due to what's called SAD, the Standard American Diet. We have a gut that has been just abused, and it cannot break down and digest and function like it's supposed to. Many of you out there may think that things are great in the gut area, but upon careful evaluation or questioning, we may find that there's more going on there than should be. So poor liver function will cause poor T4 to T3 conversion. Prior use of antibiotics and other things that have impacted the digestive system, poor gut flora will also affect that conversion as well. So we get down here where the taxi cab now has been dropped off. It's let these things out of the doors of the backseat of the taxi cab, these hormones, so now they can actually become of the free form, and then T3 will act upon the cell receptor sites here, and then that will affect some things into the cell. There are other things, though, that can impact function, for example, of the taxi cabs, using hormones, using blood sugar imbalances, insulin surges. These things are also going to impact different stages of this functional pathway. And the end result is that you are going to see manifestations of a thyroid that's not working right, but the thyroid truly may not be the primary cause.